Hello, my name is Erin Barnett. I am a Lock Haven University nursing student. I am going to discuss and demonstrate how to perform colostomy care. First, I am going to teach you what a colostomy is. Second, I am going to demonstrate how to apply a two-piece ostomy system. A colostomy is a surgical opening into the colon through the abdominal wall. The end of the colon leading to the stomach is brought through the wall of the abdomen and attached to the skin to form a stoma. Colostomies can be either permanent or temporary. It allows the drainage of stools to the outside of the body into a bag attached to the abdomen, as so. The location of the stoma, which is the lining of the intestine, depends on which part of the colon or rectum was diseased. So it may be lower or higher, to the right or left. Nobody's colostomy is in the same region. There are a number of reasons that a person may have a colostomy, such as perforated diverticulitis, an injury to the colon such as a gunshot wound or a stab wound, obstruction of the large intestine, colorectal cancer, or a fistula. If you have had a chronic disease, you can now look forward to the start of a new and healthier life. You can look forward to enjoying your favorite activities that you have enjoyed in the past. Now, on to applying the two-piece ostomy guide. You need to plan what time of day your stoma is less active, such as first thing in the morning before you have breakfast or right before bedtime to change your appliance. The first thing you want to do is gather all of your equipment. You will need your wafer, your pouch, your paste, scissors, curved ones work great, a measuring guide, your tail clamp, water, washcloth, and a towel, and soap. And if you are a nurse, be sure to wear your gloves. You can also shower or bathe with your appliance on. It would not hurt it. Okay. It may help if you stand. This will help avoid wrinkles for a good seal. Also, stand in front of a mirror if you wish. That way you can get a clear view of your stoma. Now you want to wash the stoma with mild soap such as ivory or dial just around the stoma. It's alright to get it wet. And you want to pat it dry. Okay. Your stoma, it may bleed a bit. This is normal. The materials you use to wash your skin around your stoma should be clean, but they do not need to be sterile. Be sure not to use perfumes, lotions, or oils on the skin around the stoma. This will prevent the wafer from sticking to your abdomen well. This is the perfect time to assess your stoma. It should be red, moist, shiny, round, or oval. There are all different sizes. Stomas do not hurt when they are being touched because they do not have no pain sensors. Next, you can cut or shape body hair that is around your stoma with scissors or an electric razor. Next, you want to measure your stoma using the measuring guide with an 1/8 inch of skin showing. You do not want it to be too snug or it will irritate it. This is 1 3/4 inches. Now you want to trace the pattern onto the paper backing of the wafer. Cut it out using your scissors. Smooth out the rough edges of the cut pattern and remove the paper. Next, you want to apply the paste to the opening cut on the back of the wafer and allow it to dry for 30 to 60 seconds. You can be generous with this paste. While this is drying, you can apply the skin prep around the stoma. You do not want to apply if the skin is irritated or if you just shaved around the stoma. The skin prep will help prevent stripping of your epidermis or skin as the pouch adhesive is removed. Now the paste should be dry to touch, not tacky. Remove the rest of the paper. And you want to apply the wafer starting at the bottom and working your way up. You want to make sure there is no wrinkles in the skin. You want to center the opening around the stoma, of course. Then press firmly on the abdomen and hold for about 30 seconds. Run your little finger around the inside of the wafer. This acts as a caulker by filling in the space between the stoma and the pouch edge to prevent leaking. You may want to look in a mirror to make sure you are placing your pouch in the right place. Then you want to apply your pouch to the wafer, starting at the bottom and working your way up again until you hear or feel it click into place. Then you want to gently tug it to make sure the seal is closed. Now you can attach the tail clamp. There you go. Now, you want to be sure to keep extra clamps and pouching systems with you at all times in case of an emergency. You want to plan to change your pouch every 3 to 5 days. Change immediately if you feel a leak. The leaking stool will cause itching and burning around the stoma on the skin. You also want to date your wafer or mark in a calendar to remind you when your pouch was last changed. You want to place the old wafers and pouches into a plastic bag and place them in the trash. Finally, I am going to discuss when to contact your doctor or ostomy nurse. If you notice your stoma is purple or black, if you are experiencing bleeding from the stoma that does not stop after pressure has been applied with a damp washcloth for several minutes, if you are experiencing persistent diarrhea, abdominal pain, nausea or vomiting, abdominal bloating, fever, blood in your stool, constipation, meaning you have not had any stool for 3 days, severe skin irritation around the stoma, a weight loss or gain of 10 to 15 pounds. This can change the fit of your ostomy appliance, or a change in size or appearance of your stoma. If you have any questions, feel free to contact your ostomy nurse 24/7 or your doctor. The Colostomy Association also provides support, reassurance, and information to patients with a colostomy or anybody that is about to have a colostomy. Their phone number is 1-800-328-4257. Thank you and have a good day.